just seem to be overwhelmed by my practice these days. You know, I keep rushing patients in and out as fast as possible, and I just can't keep up with the demand. Maybe I'm just running out of steam.
Have you thought about getting a PA?
A physician assistant?
Mm-hmm.
No, frankly, I really never have. I know you have a physician assistant in your practice, but
yeah.
I just never thought it would work for me. You know, it's one thing to work with another doctor, but it's another one to give up your patient to someone who's not a doc. You know, I do agree with the concept, all right, but somehow I just don't know what kind of job that other person might do. And besides that, the increased malpractice premium would probably wipe me out.
Well, when I took Bill into the practice with me, I think I had a lot of the same kind of questions that you've got right now about quality of care, malpractice premium. But let me tell you how it worked out for me. A few years ago, before I got a PA into the practice, my lifestyle was really shot. You know my office nurse, Helen. Really efficient, very good. But it seemed like all the efficiency and all the patients I had to see just left me drained. I didn't have enough time with my wife and kids. I didn't feel that I had enough time to spend with my patients either. And it was the routine stuff that was really getting me down. It seemed to me that I was just running patients into this office and out all day long, and I didn't have time to talk with them, and the whole thing just wasn't satisfying. I wasn't getting what I wanted out of being a doctor. Well, when I took on a physician's assistant, it really made a terrific change. I mean, it took a while to adjust to another guy in here with you. You have to work at it. But after a while, I began to feel that he not only took a share of my load, but he took a share of my responsibility. And I think that now I really give better care.
I just saw Mrs. Jones and her two boys.
Oh, how are they?
Well, the kids have URIs and runny noses. The lungs are clear and the ears are okay, though.
Yeah, how's Mrs. Jones?
Well, she's been complaining of shortness of breath on exertion intermittently for several months now.
Well, she smokes 2 packs a day, you know.
She sure does. The physical exam is grossly normal, though. Her husband got a promotion a couple of months ago, and he's out of town a lot more than he used to be. I think that she has some anxiety symptoms. Maybe you better see her.
Okay, I can have a talk with her. Well, what I found was that I really had more time to think about things instead of just rushing people in and out of the office and not having any time to really do anything thoroughly.
Well, sure, Fred, but how has your practice really changed? I mean, what's the difference between that and a group practice? You remember that a few years ago I was a member of a small group, and we still had problems trying to cover each other's patients.
Well, it's not really like that. Because when you share a practice with another doctor, he has his patients, and you've got your patients. And sometimes you don't really see eye to eye on how to handle things, right? But if you have a PA, he is a part of your practice. He's like a circle inside your circle of practice.
But I still don't see how you practice together.
Well, you don't really. He's a part of your practice. You train him, and he consults with you about everything. So that it's really your practice and your patients, only you just have a lot of help with it, and it really makes a big difference. For instance, we had a 57-year-old woman in our practice complaining of chest pain. Well, it turned out that there wasn't anything organic, but she was very upset about some personal problems. Well, we thoroughly checked her out physically, and then my PA started counseling with her every week for a month or so. Gradually, she felt better, and the pains went away. But my physician assistant is really a generalist. We do family practice. We see everybody. But he has had some special training in pediatrics, so he does the well child physicals and the camp and school physicals. And for him to do the initial screening on kids with URIs and earaches, well, you can imagine what a godsend that is for me. He does a lot of the basic physical procedures like casting, suturing, bandages. Takes almost all that off my hands. And if he has any problems, we review it together. We work up and rule out organic disease together. And of course, he does a lot of the charting and chart review.
Well, what about your patients? I mean, do they accept seeing a physician's assistant instead of you?
Well, there's been no problem in my practice. I think if a physician really trusts his PA, then it's not really a hard job to convince his patients to do that, too. We have a new young man working in the office. His name's Bill Lawrence, and he's trained to be a physician's assistant. He's very good. He's very nice. He's very easy to talk to. And I'd like you to see him today, if that's all right with you.
Well, if you say so, Doctor. After all, I should trust anyone you'd recommend. We've known each other so long and everything. Sure.
Right. Thank you. Helen, would you ask Bill to step in, please? Yeah. Another thing we did was to have the PA introduce himself.
Hi, I'm Bill Lawrence. I'm the physician's assistant for Dr. Charles. I'd like to talk with you a little and get to know you. We can go over any medical or personal problems that you have, and then I'd like to examine you. First of all, what brings you in here today?
Of course, some people are concerned about the reaction of the office and nursing staff to a new health practitioner, especially when the staff is older and has been together for a while, may be defensive about somebody new and unknown joining the team. And the role of the PA is really a new role in the office, needs to be explained.
I'd like to know exactly what a physician's assistant is. Oh, there he is. Let's ask him now.
Doctor, could you come in for just a minute and sit down and talk to us?
Sure.
We understand that you have hired this physician's assistant to come
Bill
into
Lawrence.
the office.
Yes.
And, well, is there something wrong with the work that we've been doing?
No. No, come on. You're both very efficient, and I get nothing but good words from our patients about you two. You're doing your job fine. This guy is really to take some of the load off my back. He's to do some of the routine kind of things that are just getting to be a bit much for me and that, frankly, I don't enjoy as much.
Well, what kinds of things will he do?
He'll be doing things like taking histories, doing physicals. He's going to handle a lot of routine things, teaching the patients, you know, patient information, that kind of thing that takes up so much of my time. He will be following up chronic patients, doing checkups and counseling, like the people in the nursing homes.
Well, it sounds to me as though we're going to be working for 2 doctors instead of just one.
No, not a bit of it. It's still my practice, and he only does the kind of work that I delegate to him, and none of it is going to be anything that involves really sophisticated medical management. It's still my practice, and I'm going to be calling the shots.
Can you perhaps sit down at some point and tell us exactly which jobs are delegated to which people?
Well, I think that we ought to have a meeting, and we ought to decide that among ourselves. I really need input on this, because it is a new kind of problem about how do you handle scheduling, keep the flow of patients going through the office and that sort of thing, working everything. But I need your help on that kind of thing, and I think it would be great if the 4 of us just sat down and took an hour sometime and talked about it. Could you give me some time and do that?
Oh, yeah.
Sure.
You
sure.
bet.
I think that's a good idea. Doctor, I'd like to know, right now we schedule 15 minutes for each patient visit.
Right.
And I need to know whether we're going to need more time for scheduling or not.
At first we will, yeah. At first we'll be interviewing and examining patients together. And so you'd better schedule Bill's appointments half an hour each.
Right.
Then later on we'll be seeing people separately, and you can schedule 15-minute appointments. But you'd better save me 15 minutes at the end of every hour so that I can get together with Bill and check on things with him.
Okay, that sounds good. I'd like to have some time to get together with the two of you so that we can go over office procedures and lab procedures so that I can get to understand how things are done around here since I'm so new. I don't know how I'll get along without the two of you.
Sure, we can
Okay.
help you.
So we have a staff meeting once a week to discuss patient care, set rules, and negotiate roles.
I would like to start, if I might. I am concerned about Mrs. Nelson. Whenever Mr. Nelson has to come to the doctor, she has always just been terribly nervous about it. And whenever he came for his routine cardiac checkup, she would really be anxious. Now, since he's had the MI, 3 years ago, she works herself into an absolute state every time he gets near the doctor's office for whatever reason. They both have high blood pressure. She gets nervous. It makes him nervous. I think before he comes in for his next routine checkup, I think that one of you or one of us should get together with her 2 or 3 times and talk with her and kind of calm her down and get her blood pressure stabilized before he has to come in.
Sounds like a great idea.
I've gotten to know Mrs. Nelson pretty well. I've seen her 3 times in the last several months. Once for a pap smear, once for a cold, once something else. I get along fine with her. I think that if I see her, I can get her calmed down and evaluate her blood pressure and have no problem with her.
We feel that regular meetings of the entire staff help us deal more effectively with all kinds of patients, from those with respiratory problems to those with drinking problems.
One of the things that was really reassuring was when the patients themselves began asking to see the physician's assistant.
Morning, Mrs. Friedenborg.
I wonder if the doctor would mind if I saw Mr. Lawrence today instead. I know how busy the doctor is, and last time I saw Mr. Lawrence, he was so understanding of my particular back problem. He seemed to know just where the particular problem was, and I thought that I would just have a few questions to ask him, and I would think it would be all right.
I think that would be just fine, certainly. I will call Mr. Lawrence, and I'm sure he can see you in just a few minutes if you'd like to have a seat right over there.
Thank you.
Good.
Well, it sounds all very nice and idealistic to me, Fred, but what about money? What about third-party payments?
Well, the PA's services are really part of what I do, so I just bill under my name. That's what the AMA recommends, and Blue Cross, Blue Shield, the other insurance carriers, they all accept those claims without any question.
Well, what about malpractice insurance? Aren't you sort of hanging out there to be shot at when you work with somebody who's not a doctor?
Well, as far as malpractice coverage goes, it costs about $400 or $500 a year more to cover your PA along with you. And I've talked to the American Academy of Physician Assistants, and they say that there has not been one malpractice suit that involved a PA. And actually, I really feel like there's less chance of malpractice in this office since I hired a PA. Because as I told you, my practice was really starting to run me. And now I feel like I've got time to think, to really be with the patients who need me, who are sicker and really need me. To have a word with you, because sometimes when you tell people that they've got heart trouble, they really panic. And I don't want you to really be worried. You know what a pacemaker is?
No, I don't. I've read about them, but no.
Well, let me show you a picture. That's your heart.
Mm-hmm.
You see that place right there?
Mm-hmm.
Well, that sends out impulses that are almost exactly like electrical impulses. And they cause the muscle in the heart to contract rhythmically. And that's what makes it work like a pump.
Mm-hmm.
Now, that place is not working very well in your heart right now, so what we want to do is to put a pacemaker in.
And you think that'll help me?
Absolutely. You see, it'll make your heart contract regularly, and that'll do the job better. And it's really not something that you have to worry a lot about because it's not that complicated a procedure. Okay?
Mm-hmm.
Well, I do know a lot more than I did, but you said this made a big difference to you personally. How was that?
Well, it's a much more stimulating professional life. I'm acting as a teacher, and that makes you stay on top of things. Really keep your skills up. I have a lot more time to spend with my family. Seen an awful lot of my kids lately. It's great. And I have time for myself. I read, listen to music, go hiking sometimes. But I guess the main thing is that I feel a lot more together. And I feel like I'm really being the kind of doctor that I always wanted to be.